from the interview process, the entry, like even before they become the staff, uh, we're very, very clear on what our core values are, our expectations, and what it's mean to join.
Hello, thank you so much to both of you for joining today, and really appreciate you taking our time. And this podcast is all about learning the experience of healthcare leaders, founders, and executives. And I'm sure both of you have a great story to tell, especially your vision and your philosophy behind MindWell. So I think it can be a great starting point for us to initiate our conversation. What is the philosophy behind MindWell and what you are trying to accomplish at this?
Right. Well, thank you for kind of meeting with us, and like we're happy to share our thoughts about that. We're doing a great job with this podcast. Um, my name is Dr. Dalloul.
And I'm Dr. Arbach.
Uh, we are co-founders of MindWell. Uh, we are partners in life and in work. We're husband and wife, and we've been together in this field of medicine and psychiatry for years and years. Uh, we started like on separate platforms, where Dr. Arbach was more focused on academia and medical education. I was more focused on administration.
So from our experience as part of the community and also as healthcare providers, as psychiatrists specifically, we wanted to start a psychiatry practice that help with combining everything that we felt is working okay or working great in the healthcare field, but also adding the things that we felt they were needed. So the main philosophy behind MindWell is a holistic approach to patient care, where we approach each patient as a whole, where we learn about the patients, not only their psychiatric issues, but also their habits, their families, the names of their friends sometimes. So we approach all their life to help them reach an area that they are happy with their psychiatric care. We do rely on medication management, therapy, and interventions such as TMS. And we help our patients not only get the treatment they need, but also have that self-awareness to be self-helpers and to be able to keep that momentum even after if we discharge them from the clinic, which is something we do. And another thing that we wanted to focus on that we felt was missing from many areas where we practice medicine is collaboration between providers who take care of the patient. So we collaborate with therapists, with primary care, and we felt that this really offered a great care to our patient. The patient felt that we really care about them, and even the other providers found that communicating with psychiatrists gave them help in the area they are also helping the patient.
So thank you so much for sharing this vision, this story. This is very powerful. And I was looking at the MindWell website, and one word resonated many times. It's integration, integrated. I think that's the probably one key pillar of this organization is that integration means that if I'm understanding it correctly, it's not only about one entity patient, it is also about the stakeholders, the other relevant parties in the community, and maybe family members of the patient as well. So how does you treat this as an experience? Because I'm sure not a lot of organizations in the mental health space are probably doing that. You are going one step ahead to provide care. So is this also part of your philosophy in MindWell?
So I think I didn't get the question well, like I didn't hear you well. But are you asking if the philosophy of mind will involves a significant level of integration?
Yes,
Does that work?
And how does that work, like in the daily application of the
right,
care?
right.
You want to take that? I think, I mean, as you mentioned, as Dr. Arbach mentioned, that integration in between multiple providers, multiple settings of care, multiple specialties is always a significant element of the care we provide. It's usually missing because a lot of time our healthcare systems are siloed in how they're providing care and like how much they're communicating. The information do not really travel from one system to another seamlessly. You need a lot of kind of organizational efforts to actually plan for two providers to talk and collaborate and think together. So we try to bridge that barrier. We try to kind of overcome that barrier with integrating other providers, engaging them from the get-go. We constantly reach out to providers in the area, local providers, and have like frequent talks, discussions, sometimes general, sometimes about specific cases. So we try to keep that bridge actually smooth and always kind of oiled out so that there is ease of communication. And we collaborate whenever there's like a mutual cases, as long as the patients are agreeable with this level. Another level of integration that we find is necessary and it's kind of an overlooked piece in the mental health care in general is like that kind of personal integration for the patient to integrate actually their mental health into their physical health and the other way around, and helping patients integrate both elements and seeing themselves and their health as a one unit rather than like also separate disciplines that are like separate. So,
And if I can add to that, we also focus on, or we're passionate about integrating education into healthcare and into our daily practices. So, either education on the students level, we are both faculty in two medical schools. We always have students with us, and we also work on helping other providers in our practice, either mid-level providers or other colleagues with discussions about cases, about certain topics, and we feel that education and spreading the knowledge and the ability to not also having the knowledge but search for that knowledge, the ability to learn and being open to learn more information is an important part of what we
Thank
do
you.
as
So I want to talk a little bit about integration in terms of applications, softwares, and tools as well, because I think care can be improved if, yes, the level of integration can be extended to applications and softwares as well, where if that happens, data sharing will become easy. You can share the outcomes, you can share the learnings using modern technologies. Is this something you are doing currently, or is this something that is on your roadmap for future?
I think we started kind of focusing on integrating the technology elements of healthcare early in our
well.
start. We started our practice maybe 2019 or so, and soon after COVID hit, and everything was disrupted, and immediately we had to integrate the options of telehealth and remote document sharing and stuff like that in our practice. Uh, we did a lot of work to integrate that seamlessly and prevent any disruption, interruption of care for our patients. And from there, we learned the value of like how much technology can be, evolved and utilized in the healthcare field, and how much psychiatry is kind of not capitalizing on that value nowadays or so far. And we've been striving continuously to integrate every element of technology that can help our patients, help their experience in the care. Uh, automation processes, AI processes, and how they can seamlessly fit into the picture without disrupting the patient's experience, without causing any shifts or discomfort for any sides or any stakeholders in the experience, whether our staff or our patients or providers. Um, so that's been an ongoing process, and it's been an exciting kind of project,
Yeah.
in the past couple of years.
Yeah, in addition to standardizing a lot of things that help the patients see where they are on their recovery journey. For example, we started very early doing scales for everyone and adding that to our medical record and showing the patient that this is where you are, some objective measures of where they are. And now with AI coming on board, that will help also taking care of too many things in the background, that will free the staff and the providers to have more face-to-face patient time with the patient, and adding their human part of the equation, where too many mundane things are being done by AI.
Okay, absolutely. So is virtual care or telehealth, you guys are still using that? And if so, what percentage is it on virtual care at the moment for you?
We're definitely using virtual health. It's roughly about 50%, slightly less than 50% of our day-to-day work. We try to use it at the level of patients' comfort. Some patients actually are just using telehealth, some patients are just in person, and some people may go back and forth between like what works for them.
So I just want to share one small learning, and this is very relevant to mental health practices. That telehealth is being used. I think it's on the rise, if I would say, after talking to many professionals in the mental health space, and they are really leveraging AI great extent. So what they are doing is basically just like we are talking, they are actually recording the telehealth conversations, and then AI is working in sentiment analysis. AI is doing its own processing to identify some insights about during the conversation. And what doctors and clinicians and physicians are doing is, apart from their own assessment or their own notes, they go to AI and see what else AI has pointed out, using sentiment analysis, using speech analysis, using behavior analysis. And on the basis of that, like out of 10, 2 or 3 times they are able to find some information which really helps them to go to the next stage as well. So while we talk to people in many domains of healthcare, but I understand combination experts in mental health clinics, because now they have luxury of having a recording of a conversation, and they can play it many times, they can watch it, and then they can also consult the notes that AI has created to see if they missed any insight.
Definitely with the kind of this special consideration of mental health and patients' level of comfort with doing, because a lot of patients, they when they want to discuss certain things, they definitely want to come to the office and be in person. Sometimes they prefer that even sometimes they prefer that there is no student in this session, because some things are very hard for the patient to discuss. So the special consideration of being in mental health require that kind of critical judgment of each case on how much we can integrate technology versus how much we need to add our human interaction, and all of that in respect of the patient's also need and comfort, level of comfort.
Of course, definitely. So, in your day-to-day work, what is one common challenge or frustration that typically comes up for you? If you have to, I'm sure there must be many, but if you have to point out one challenge or frustration.
I think one of the daily challenges is the red tape of the healthcare system, insurance barriers, insurance kind of paperwork, things like that. This is a necessary struggle, though, right? This is the healthcare system is set in a way where the insurance payers are responsible for being able to provide sufficient coverage of quality care, and they have the parameters to kind of go over that, and they vary. So there's multiple plans and multiple tiers and so on. So navigating that kind of daily web of information interaction is an administrative burden always on medical offices. A necessary burden, but it's like one of the most forefront kind of challenges that you see on a daily basis. You might want to add in.
Yeah, I think accessibility to care and the ability of patients to access our care first from uh, different. There are different barriers, starting with the stigma about seeing a mental health provider. Uh, we are grateful that this stigma is going down, is decreasing, but it's definitely still there. And the ability to access certain services once they see the psychiatrist, their ability to have a place when we want to refer them to certain therapy modalities, to certain programs. Accessing care has been one of the challenges that we're facing with our patients. And that's another reason we always like to collaborate, to be out and meeting with other providers, with other service providers, so we are able to provide our patients with the largest possible web of services that we can do.
Right, understood. So, how does your current workforce look alike? I mean, what's the size of your workforce, and how are you looking ahead to? Are you looking ahead to hire more team members with you? And if so, are you looking to add team members on clinician side or on technology side or getting help on the administrative side of things?
Our support staff, and I'm assuming that you're asking about the support staff and the administrative staff. Our support staff are have been with us for a while, for a long time. The way we approach that is that staff that are working with us are working as if they have a stake in the work, in the business, in the growth, and they practically do, because we always try to reflect whatever growth or benefit the practice is having on their experience, whether it's in terms of like rewards and sentimental kind of encouragement, to actual bonuses, to year-end bonuses, and so on. Trying to be available and supportive in terms of what benefits the individual have and so on. They're part of the decision making in every administrative level of the work. And that's why we try to kind of slightly overstep, because we want to make sure that everyone has enough space of comfort to be as attentive as possible. So if you look at our staffing kind of roster, it might be a little bit more expensive than what you would expect for a practice medicine. But that's kind of deliberate effort on our part to make sure is comfortable enough to the point that they can reflect their comfort in their patient care.
So one important thing, I think, you both wear many hats. I think you are co-founder as well, you are a clinician as well. So it's not easy to manage both. So in your experience, what part of your job is more challenging?
more
challenging.
challenging.
Yeah, I think I wouldn't say challenging, maybe challenging and at the same time more rewarding. So I think it's these cases where we have to integrate both the clinician side of things, but also the administrative side of things and the advocate side of things, where we have to go beyond what's just a regular case and maybe reach out to certain services, reach out to insurance multiple times, and at the same time help the staff in an area where they are not very experienced, to lead them toward what needs to be done in order to help the patient on a clinical base. But definitely being in both positions where we do the service, also we lead the team, help with kind of having that experience of the day-to-day work and reflecting that on the leadership side of things.
Plus, I would add that the challenge of these multiple hats is definitely significant in terms of like transitioning from one hat to another, from one role to another. But it's also rewarding in its base essence that we come to this whole practice. Our passion, our mission is to help people overcome their brain illness, their mental health difficulty. And many times we find ourselves able to help as comprehensively as possible when we are fluent in all these hats, where we understand their payer structure, we understand their insurance ins and outs, we understand what it means for them to schedule and then have to reschedule, and or how hard it is for them to kind of get their paperwork on time and so on. So when we are able to understand all these roles, we are able to really help the patients as comprehensively as possible. So everyone, we try to make sure that everyone is aware of the elements of all these roles. So whether providers or even staff, we try to have open dialogues so everyone is able to appreciate the full circle of the patient's experience.
Right. So, and a question came to my mind, especially when you were talking about your staff members. So, it is not always easy to onboard new members to your team and make sure they are culturally aligned and they know your core working values. For example, it may be patient centricity for you. So, you both, as being leaders, what measures you take for your staff to truly make them understand the core values of your organization and make them understand that customer is above everything else. So what are the processes or measures or approaches you have in place, and any advice you would like to give to our listeners in this regard?
Mhm. I think we start from the interview process, the entry, like even before they become staff. Uh, we're very, very clear on what our core values are, our expectations, and what it's mean to join MindWell. We encourage people who interview at our organization to really view this as a potential opportunity, and we even try to understand their interests and needs and visions and ambitions so that we can help. Like even at the interview level, we try to help applicants actually find the right work for them, and even like we'll refer them somewhere else, if we think or if they think that it's actually a better fit than us. So it starts from day one and even day zero at the interview level, and as soon as they start by engulfing everyone in that core value.
Yeah, and in addition, we also rely on training, a lot of training, and we understand that this is always a learning process, especially in mental health, where, as you said, you're dealing with different type of situations. Sometimes the staff have to kind of take a moment and support each other. We support them. And one of the most important things that we focus on is that the staff align with our vision of the patient being at the center of everything we do. So we focus always in our meeting, in our discussion, that patient care comes at before anything else, and it has to be reflected in everything we do, from answering the phone call to sending bills to seeing the patient, rescheduling appointments. Everything has to reflect that we are a patient care facility and we are providing that care with the patient's best interest in the center of all of that.
Got it. So if we have to talk about big picture vision for MindWell, I'm sure you folks might have brainstormed on it. Where you want to be, let's say 3 years from now on.
Our vision, our mission is to make sure that this help in terms of mental health is available as widely as possible. One of the main pillars of our values is access to care. So we want to see MindWell being able to provide access to care in as many places as possible. By access to care, we mean that we try to take every insurance that's in the out there. We try to make sure it's one of our biggest goals not to say no to anyone, uh, because we want everyone to be able to access care. We try to make it readily available as soon as possible so people are not waiting for appointments for weeks and weeks. We have very strict policy of making appointments available within. That's one of our main like visions is to really make access to care available, quality access to care, because sometimes access to care can vary, and we want to make sure that quality access to care is available to all that needs it. Um, and then we want to make sure that we're incorporating the cutting edge technology, cutting edge understanding of and developments in the psychiatric field.
And expanding on services, number of providers, the location numbers that so we're always having this growth mindset where we want to better our quality of service, but also expand the team to have more growth in how many providers we have, possibly opening more locations, growing the team, and utilizing technology is helping us doing that in a more efficient way where we can keep growing but also focus on patient care.
Let's say you have the luxury of solving one challenge today. What will be the topmost priority for you? Manpower, technology, or integration? If you have to solve one problem today, what that would be?
I would say integration, uh, because manpower and technology, although can be daily problems, they are there's much more tools to work on them, and there's much more options. Cannot figure that out. But integration is a system-wide problem. We try to tackle it and minimize it as much as possible on our end, but still, it's the challenges are there and are daily, can impact patients' care in ways that are outside of our control. So I would focus on if I had the magic wand, I would focus on the ones that have uh, more factors that are out of our control.
Right. Thank you so much to both of you. It was great talking to you, and I'm really inspired by your story and your partnership. And I wish you both all the best with life and MindWell as well. And we are really excited to get your story out to the public. I'm sure it will be inspiring to many professionals, many founders. Thank you so much. I
Thank you.
really appreciate it.
Thank you. Thank you very much.
Have a great day.